What is ABA? Welcome to Attendant Care Autism Services. Here at Attendant Care, we know that autism leaves a lot of questions, but we've got answers. So, your child has been given the diagnosis of ASD, Autism Spectrum Disorder. You may be hearing from doctors, friends, or the internet that your child should start ABA. But what is ABA anyways? ABA stands for Applied Behavior Analysis, which is a natural science focused on the principles of learning and behavior. ABA includes altering what happens before and after specific behaviors occur, to modify an existing behavior and to assist a person in learning new behaviors. Behavior analysts use the principles of ABA to create interventions for socially significant behaviors which significantly impact a person's life. Behavior analysts use evidence-based procedures based on research studies to create these interventions. Behavior analysts decide how and when to best intervene on behaviors by taking and analyzing data very carefully. Behavior analysts definitely like to be precise. So that's some of the technical details of ABA. But what can ABA actually do for your child and your family? ABA can be used to improve many areas of your child's life as well as your family's. Some areas of improvement include decreasing problem behavior, teaching communication skills, teaching skills and flexibility, skills in appropriate play and socialization, appropriate eating skills, teaching behaviors which allow a person to participate in community activities, skills in making and interacting with friends, pre-academic and school readiness skills, vocational training, and so much more. Behavior analysts also offer parent education, so parents can be empowered to teach and guide their child using the principles of the ABA. Another very common question is, who can and should receive ABA? Many people hear that ABA is just for young children with autism, but that's certainly not the case. Behavior analysts work with individuals of all ages, from toddlers to adults, on age and socially appropriate skills. While often insurance will typically only cover payment for ABA for people on the autism spectrum, behavior analysts work with individuals with a wide range of abilities and needs. It's also important to know who exactly you'll be working with if you're considering ABA. The person you'll interact with the most is a behavior technician, or possibly a registered behavior technician, or RBT, if the technician has received special training and passed specific exams. The behavior technician works directly with your child during all therapy sessions. To do this, he or she will have already been trained by a master's level clinician and will be regularly supervised by a master's level clinician. The behavior technician follows all treatment plans and behavior plans designed by the master's level clinician. But most importantly, the behavior technician will be working tirelessly to help your child reach his or her goals while also having fun. Another very important person on the ABA treatment team is the board-certified behavior analyst, which is often called a BCBA. The BCBA is the master's level clinician who trains and supervises the behavior technician. Occasionally, a BCBA may also have a doctoral level education, but both master's and doctoral level BCBAs have gone through rigorous education, experience, and examinations to earn the BCBA designation. The BCBA completes all behavioral and skills assessments, designs and monitors behavior and treatment plans, and supervises and trains behavior technicians. BCBAs also work closely with parents and families to ensure that everyone involved understands the child's treatment plans and that meaningful and appropriate goals are addressed. Your BCBA is definitely your point person on all things ABA. Let's talk a little bit about what you'll see during your child's ABA therapy sessions. Certain programs require discrete trial teaching, or DTT. DTT is a very structured instruction to meet your child's goals. Often you'll notice repetition of instructional delivery throughout the session, but that's to ensure your child is working towards mastery. In other programs, you'll see the technician using natural environment teaching, or NET. While this manner of teaching is also structured, it is embedded into naturally occurring activities in the home, school, community, and sometimes the ABA clinic. NET will often be utilized to ensure your child has mastered a new skill both in the teaching environment and the natural environment, where the skill will actually be used. This often sounds like a lot of work and may leave you asking yourself, why bother with ABA? The answer to that is so simple: the results. ABA has been proven in many research studies to be an effective means of reducing problem behaviors and increasing positive behaviors, especially with individuals with ASD. If you think ABA may provide some positive results for your child, reach out to Attendant Care Autism Services. We'd love to provide you with more information or to get you started with an ABA program. You can reach out to us by email at request@accofmi.com or by phone at 586-228-9991.